Guys, we're gonna discuss one of the cases which is actually trend. It was a trend. Okay. The topics we're gonna discuss, we're not only gonna discuss one topic. Today we're gonna discuss, I believe, 5 important topics for the exam. So please, guys, ensure you pay attention and then you have your own pen and paper and write down all the information, guys. Please, guys, also if you see me on the Facebook, on live Facebook, please, guys, let me know. Thank you very much. You have 2 options, one to be on Zoom, actually 3 options, 1 on Zoom, 2 on Facebook, 3 on YouTube. So guys, whatever you believe going to be the most beneficial to you, please, guys, just join it. Thank you very much. And the good thing about the Facebook is you can participate with me. You can ask questions. And you also can leave comments. Thank you. Please, guys, if I'm on Facebook right now, let me know. By the way, if you want to discuss with me this case live, please, guys, be on Zoom and raise your hand so we all can talk to each other. Dr. Larry raised her hand. Okay. Hi, Dr. Larry, how are you going?
Hi, Dr. Peter.
Let me just get this here. Hi, Dr. Larry, how are you going?
I'm very good. How are you?
Good, thanks, Dr. Larry. How was your day? How is the clinic going? How's your work? How is your preparation? How's everything?
Really busy, but I'm here and I'm always ready like a Boy Scout to discuss. I love it.
Okay, very
So
happy. You
I
see, I
hope
love, yes, tell me, please.
I hope we get like last week, few people discussing very nicely. I love it.
We always have the best champions ever. I see, Doctor, I see, who's guys put the hand, someone put the hand up. Okay, let me check. The more the candidate, that's all I say. If you really want to learn, you must talk, you must discuss. And that's a way. Okay, let me check.
Dr. Peter, would that be okay if I kind of like mute and unmute myself as we speak, just because I'm putting my daughter to bed?
Yes,
So
definitely you
yeah,
can do it.
thank
Yes,
you. Thank you for
no
that.
problem. That's all good. Then thank you very much. Okay, guys, please, guys, if you want to discuss this case with me, if you believe, you know what, I will tell you what the case about. If you believe, I know every one of you are brave guys, and we all dentists, and you are very smart. Okay, I can see here as well. The more guys you speak loudly, the more you get trust, confidence, and you will pass the exam. And it will be hard to forget information. It will be easy to remember the information. Okay, let me just get here as well. Okay, guys. Let's check, guys, if I'm on Facebook or not. Guys, please, guys, if you see me on the, oh yeah, I can see I'm on Facebook Live right now. Yes, I see the champions as well here. Let me get this one here as well. Guys, can you see my screen, by the way? Can you see the case?
No, Dr. Vito, it's just the first slide.
Okay, but at least the screen itself, right?
Yes,
Okay, I
definitely.
showed something. Okay, that's very good then. Okay, so what I need to do is here. I think guys, if there is any echo, please, guys, let me know, because always when I start, there's echo when I move from one app to another app. So you may hear some echo. Okay, echo. What I need to do is I need to put and I go zoom from here. Why I hear myself from here? I think I need to put. Guys, is there Dr. Larry? Can you please say hi? I want to hear you.
Hi, Dr. Peter.
I think I need to. Guys, is there Dr. Larry? Can I be say? Oh, okay. This is bad one. I
Yeah, I can
think.
hear the echo now.
Okay, that's fine then. So I believe what I can do is from Zoom, from here, what I can do, I just put this one up here, put this one here, then this one down. I think now things should be fine. Dr. Larry, can you please speak to me again?
Hello.
Yes, good. There is any echo from my side at all?
No, I can't hear any echo, but I'm only
Okay.
on Zoom right now. Yeah.
Okay, very good then. Guys, please, guys, on Facebook, I see you on Facebook as well. So please, guys, if you see me as well on in Zoom, please, guys, let me know if there is echo or not. Okay, guys, so I see the good champions started right now. Zoom sometimes participant on the slide. What? I don't want. There's too much things here. Why this one here? Okay, let me share this, guys, to you. Okay, guys. Hi, Dr. Bella, how you going? Dr. Preya, Dr. Jinal, Dr. Sanjana, Dr. Kavita, Dr. Marlene, Dr. Sahil, Dr. Navneet, Dr. Musa, and Dr. Musa. I love critical thinking session. Dr. Bidu, I love it too. And I love every one of you guys. Dr. Shiba, Dr. Fatima, Bleaching, maybe next time. Hi, Dr. Farah, Dr. Shiba, Dr. Sahil, Dr. Dipali, Diwali, Dr. June, Dr. Sibe, all our best champions ever. Dr. Iman, Dr. Movia. Yes, guys, no echo. Okay, very good. Okay, quickly. What do you think, guys, this class about? Which case, guys, we got to discuss today? Dr. Parisa, how are you going? What do you think, guys, the class is about today? By the way, we have here three champions. They will participate in this class with me. I see Dr. Larry, Dr. Amna, and Dr. Cinderella, Dr. Oindrella Cinderella. Guys, if you want, guys, you see, guys, I never stop anyone to discuss with me. I always, guys, very happy to all together discuss about this case. Just raise your hand, and then you can discuss with us this case. We're gonna discuss multiple topics, not only one. We're gonna discuss multiple topics or multiple important topics for the exam. Dr. Amna, can you hear me?
Hi, Dr. Vito.
Hi, Dr. Amna, how are you going? I was thinking about you today, by the way.
Really?
Yes, because I remember last time, and then we have, you mentioned to me that if I'm in Sydney, just to let you know. So we are in Sydney right now. I'm in Sydney. I'm in
Oh,
Sydney
you're
Academy.
right.
State.
Okay.
Okay?
I'll try to come.
Yes, no problem. Then if you need any help, just let me know.
Can I
Dr.
ask a question?
Uh,
Can I just ask one question right now?
yes, oh wow, seems like you cannot sleep because this question.
And no, I'm just taking the opportunity.
Okay, tell me what's the question then. Tell me,
So,
please.
Dr. Vito, remember the the fluorosis case in which we're supposed to do we're supposed to microabrade and then do a resin infill on top. But
Yeah.
in Australia, people are using the Icon kit a lot. I mean, it's very popular.
Which one?
And
Which one?
Icon.
Okay, icon. Yes, yes, yes.
So in Icon kit, what I've seen on YouTube videos is that they do a round of etch and then they dry and then they see maybe they need another round of etch and then they do the resin infill. And in microabrasion, it's the same. It's acid and the abrasive. So my question is that if we're doing microabrasion and resin infill, we will do just one round of etch, right?
Yes, one round. Yes, will be enough. Yes.
That with the pumice and the hydrochloric acid.
Yes, you can do this. Yes.
Okay. Then we won't go again with the H.
No, I think one is enough as long as it's nicely. You can see the frosty has happened on the tooth structure. Yes.
Okay.
The white frosty. Yes, appearance. Yes.
Okay. Got it. Thank you.
Okay, no problem. Thank you, Trump. Okay. Okay, guys. I believe it's a good time start right now. And then it seems I'm happy because there is no echo. And same times I can see you champions on my I can see you on the screen, which is very good. Okay, ethics, no. Infection control, no. Medical emergency, no. Implant, no. Okay, this is the case, guys. Easy, easy, easy peasy. This is the case. It's a trend always. We're gonna discuss multiple things, not only one thing. Okay, guys, can you see my slides right now? And by the way, guys, I made things easy to you, very straightforward, and then you're gonna enjoy it. Let's enjoy right now. So, guys, the things we're gonna discuss today, we're gonna discuss about the clinical presentation of the case, which is, I will tell you soon what is about the case. Then, how this has happened. Okay, guys, so we're gonna discuss today about this, which is cracked tooth and vertical root fracture. So two things together, cracked tooth syndrome and vertical root fracture. So I added vertical root fracture as well in this case, just to make it interesting, plus cracked tooth. Then also we're going to discuss about adrenal crisis, meronge, pain management, what sort of painkillers you need to prescribe in these cases, and short-term and long-term management for cracked tooth syndrome and vertical root fracture. Do you think, guys, these topics are interesting topic to you guys? What do you think?
Amazing.
It is, you
Yes.
like it?
Love it.
Look, these topics actually, I believe lots of candidates have issues, especially meronge plus pain management, cracked tooth syndrome. These are the things, and definitely vertical. Look, you know what? All of them. Totally agree. Okay, I see, guys, please, guys, if someone really, if you are, for example, right, guys, if you are prosthodontist, if you are endonist, I think these cases will be easier to you to discuss. So, guys, we can discuss together. And plus, also we have Dr. Cinderella, Oindrella. Dr. Oindrella, hi.
Hello, Dr. Vido. How are you?
How are you going, doctor? Is it, look, I like your name. Is it, how do you pronounce it? Is it Oindrella, like Cinderella?
Yeah, that's correct. Undrila.
Ondrella, right? Ondrella.
Yeah, yeah, doctor.
I love that. It's very nice. Okay,
Thank
thanks.
you.
Thank you very much, Dr. Ondrella. Okay, and Dr. Larry, let's guys discuss the case together. Also, who's guys willing to do role play as well? Dr. Amna, I think you're willing. Are you willing to do role play, right?
Yes,
Seems
I
like.
don't know how the hand, I did put my hand up, right? Where did
That's
it
okay
go?
then. You the
Yeah, I want
purpose to
to.
put your hand is already done, so
Do
that's
it,
okay
Dr.
then.
Amna. Do it. You need to do it.
Of course. Why not?
Good job. Very good job. Okay. Okay, guys, let's discuss the case right now. All the best to everyone. Let's enjoy this. So the case is about this. The case guy, James, is a 45-year-old male who presents as a dental emergency complaint of pain in his back lower molar. The pain commenced after biting down and unpopped popcorn. He reports a history of bruxism, grindings, and is currently under significant personal stress. On examination, a 7 mm periodontal pocket was found on the medial side of the root only, of one side, medial side only, with no generalized periodontal disease. His medical history is significant. He has an asthma managed by paracetamol, which is Ventolin, and rheumatoid arthritis, for which he has been taking prednisolone 20 milligram daily for 4 years, osteoporosis managed with an oral bisphosphonate tablet, and he is taking Katia, which is aspirin. Okay, now tooth, look at it right now, guys. What you, when you look at the tooth here right now, what is, okay, so Dr. Amna, Dr. Andrella, and Dr. Larry, you know this very well. Okay, we don't answer except only for 20 seconds first,
20
and
second
everyone,
rule.
yes, 20 seconds after everyone on the Facebook, our champions, to answer first what they see. And then, guys, also what we need to do is we need only to answer only 1 point, not more than 1 point. Okay, to give chance to everyone to go through the rest of the information. So guys, looking at this photograph here right now, give me guys one finding here, please. At least one finding. Let me check on the Facebook what the champion's saying there. Mesia, crack, 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 crack. Okay, very good. Crack running mesiodistally. Okay, very good. Dr. Steffi cracked Sepia, Dr. Hammond, Dr. Bala, and Dr. Anon cracked. Amazing. Crack. Everyone say crack. Doctor, what do you think? Any more finding guys you have seen in this case?
But there's a filling in the tooth.
Filling. Yes,
Big
composite,
filling.
right?
Yes, composite filling, big
I
filling.
see composite filling as well.
And some abrasion facets, like signs of
Abrasion
bruxism.
or atresion?
Sorry, yeah. So
Atresion facets, like this facets here and stuff, right?
yeah, and the tooth surface
Flat.
seems to be flattened.
Flat surface. I love these findings. So crack, large restoration, plus there is facets here. I see facets and the flattened
Where
surface.
facets? Sorry, that's
Yes,
what I
that's
meant.
okay. That's good. I love this. You see, guys, you must have these eagle eyes. When you have this type of eagle eyes, exam will be easy to you because exam based on this small findings you can see on a tooth. Okay. Any other findings, doctor? Do you want to add, or this is enough now? Enough? Okay, let's
Yeah, I
check.
think it's enough now.
Yes,
Yeah,
enough now.
enough.
Okay.
There is staining, but that's not significant for our.
Some stains, yes.
Yeah.
Not very best. I agree.
Not
That.
Is
significant
there
to our
any
case.
caries at mesial surface?
Okay, on the mesothelial caries, you mean on the same tooth, different tooth?
The same tooth, Dr. Video.
It could be caries whereabouts. You mean this area
No, the opposite area.
here?
Maybe that is, yeah, that is the one.
Yeah. So I think the crack and then there's a stain inside. It could be caries as well. Maybe by X-ray will be showing better, right?
Yeah. Right.
Okay, so we may need to take an X-ray for this one then. Okay, now the scenario, guys. Let's take all the risk factors in these scenarios. Every single risk factors we need to identify. Actually, no. Guys, this is a way, if you read any scenario for the exam, any scenario, you must, you know, guys, what is, apart from the bold part, I'm not saying now about the bold part, forget about the bold part now. In any scenario, if you really want to analyze, because you must analyze your scenario properly before you answer the questions, whatever it is. So what is the first thing ever? You need to look at the scenario. Okay, 20 seconds for our champions with the 3 champions right now. And then let's see what the champions the Facebook going to answer. In any scenario, you're going to get an exam. What is, if you read the scenario, what is the first thing you must look at first? Wow, very smart. Okay, I see that Dr. John has both the right answer, Dr. Ayushi, both of them. Okay, Dr. Larry, what do you think?
So we
Yeah.
need to, we need to look at the risk factors, definitely.
But before the risk factor,
Chief complaint?
Yeah.
chief complaint, right? Do you agree, guys, on
Yes.
this, everyone here?
Patient is
Okay,
in pain. Yeah.
Yeah.
very good, the chief complaint. And then from chief complaint, what we need to do, what we need to know. What is the first most important things in chief complaint? I must look for it. The first thing ever in the chief complaint. Give
20
20
seconds?
seconds again. Yes, 20 seconds.
Okay.
We
Oh,
can even think
my daughter
properly.
is counting.
I count.
9, 8, 7, 6, 5, 4,
Who's counting?
Oh my God.
My daughter.
0.
Pain history. My daughter counted 20 seconds.
Oh, 20, don't say hi to her then.
20 seconds.
Very good, Ben.
Pain
Yes.
history, I believe.
Now,
Yes.
yes. Now we can do it now. Yes, please tell me now.
Pain history.
Pain. Thank you very much. Pain history. Why pain history? Because guys, actually, what you think is about the management today. You need to know is this case today or the patient's complaint today has any priority to manage today or not. There's any emergency you must do emergency treatment you must do today or not. So definitely if the patient has severe type of pain, mean now pain itself today is my priority. I will not care about that much more than I care about pain today. Am I guys clear about this right now?
Yes.
Yeah,
Yes.
clear.
So chief complaint, the most important part in the chief complaint, the first things I'm thinking about it, pain history. If the patient has pain and how severe the pain. Okay, why? Because the patient really come today because of the pain. That is the main reason. Now, so the second thing in the scenario you need to look at after chief complaint as a part of chief complaint is pain. Now, why chief complaint is important? What? Why the chief complaint is important, and after chief complaint, okay, let's say this by this different way. Chief complaint. Chief complaint after this will have signs and symptoms. Now, the question, why signs symptoms are important? 10 seconds this time, only 10 seconds. Why signs and
We-
symptoms important as a part of chief complaint? Yes, we can answer now.
Okay. Sorry. Can I say?
Yes, please.
So they will describe, they will point us towards the diagnosis. And
Perfect.
yeah, and they
Diagnose.
can
And what else?
also point us towards the cause.
And the
Very good.
management as well. So what are we going to
Also,
do? How are we going to get them out of pain?
and management.
Yes.
Yes. So now, guys, these are the three things you need. This is, or these are the three things. Dr. Andrella, do you want to add anything here? So we said,
No,
yep,
that's
oh, good.
allowed.
Okay, very good. Chief complaint. We look at pain in the scenario. Guys, this is the gold standard how to analyze any scenario in exam. Any scenario. I'm not talking only about the scenario. Every scenario in exam. That's how we need to think. So, chief complaint, pain, signs, symptoms. From signs, symptoms, I will get into diagnosis, management, and also risk factors. Very good. Let's now jump into signs, symptoms of any existing here, and then risk factors. Or pain. Let's talk about pain. Now, do you think this patient has pain or not? Yes.
Yes.
Patient
Yes.
has pain. And pain after biting. This is good sign and symptoms. Actually, this is symptoms, right? If patient has pain after biting down, what does it mean? What is going to guide me as a part of diagnosis? Because we said diagnose now. 10 seconds. The champions
Cracked
of the
syndrome.
Facebook, everyone. Very good. Which one?
Pain on
Crack
biting.
Cracked syndrome.
tooth syndrome, right? So now, as long
Syndrome.
as there is a pain,
Yeah.
yes, after biting, so it's crack tooth syndrome. Very good. That's amazing.
There
So now
might be a
that
crack or there might be some inflammation around the tip
periapical
of the
teeth.
root. Exactly.
Yep, very good.
That's
So
pain and biting, yeah.
yes, so pain and biting can be these two things, which I believe in this right. Now, patient bite that with pain happen after they bit on unpopped popcorn. Now, do you think, guys, unpopped popcorn is this a risk factor or not?
Yes, it's hard.
A risk factor.
Yeah.
So this is the first risk factor. Let's now go more details with risk factors.
Sorry,
What
Dr.
other risk
Peter,
factors? Okay, okay. Sorry.
can I interrupt you?
Yes,
You
tell me.
said pain on biting is indicating either something periapical or a crack.
Yes.
Or does that necessarily mean that the crack is like all the way, or it could be like a smaller crack as well?
It can be small crack.
Which is
Pain on
near
body
or
if it's small
almost,
crack,
yeah,
yes.
it doesn't necessarily have to be a VRF, right?
No.
Okay.
Look, vertical root fracture is somehow different than crack. They are two different things, by the way. That's
Okay.
why I made the two cases here in one case, right?
Mm-hmm.
So I'm even going to explain this in detail shortly.
Okay.
But they are two different things here. Even the
Okay.
diagnosis different, the risk factors are different, the management will be different, everything different now. Okay?
Okay.
Okay. So now patient, okay guys, can you give me all the risk factors right now? Let's get, I see people actually they started to do to mention the risk factors. Yes, so the first risk factor was biting on hard food, which is very hard, which is popcorn, right? Which is unpopped popcorn. Very good. What other risk factor, guys? You can start right now, Dr. Andrella.
Yes.
If you look at the scenario,
Mm,
what other risk factor?
I
Let
have
me
some
just,
point after
which one?
registration
Yep, which one?
on distal side.
Paroxysm, right? Did you say paroxysm?
Bruxism.
Paroxysm. Yes, paroxysm. That's another risk factor. Tooth grinding, right?
Yeah.
Very good. Perfect. Okay, Dr. Larry, what do you think? Any other risk factor here?
So there are several things going on, of course. In our scenario, there are few risk factors that are contributing to this. However, the main thing, in my opinion, it would be yes, there is a big filling in the tooth. There is posterior forces on the, the chewing, sort of biting areas, and triggered by, biting on something hard or stress, bruxism, and all that. That would be my answer.
Yes. So do you agree these are at least the 4 risk factors, right?
Yes, absolutely.
Okay. For this condition right now, guys, because you know what? The risk factors determined by the chief complaint mainly. Because, for example, if you're telling me patient has risk factor like asthma, I'm telling you these are the risk factor irrelevant. These are irrelevant risk factors to cracked tooth syndrome or vertical root fracture. It is relevant to the management. So now risk factors relevant to the diagnosis: 1, patient biting on unpopped popcorn; 2,
bruxism.
bruxism. Yes, very good. 3, stress; 4, big fillings. I agree on this. Okay. Now, perfect. Easy, simple. Now, there is another important finding here. We missed it, guys. 10 seconds, please, and then we answer it. Because of this findings, this finding, actually, we need to get another diagnosis plus cracked tooth syndrome. So what is this, guys? I think the 10 seconds are gone now. Tell me, please, guys, what is this?
The isolated pocket.
Isolated pocket. Thank you very much. There is isolated pocket, which is 7 millimeter pocket. Now, 7 millimeter pocket depth, right? This actually by itself, it may result in it can be two things, by the way. Because guys, I tell you something, 7 millimeter pocket depth or 8 millimeter or 9 millimeter or even longer. You know what? I don't think by this way that can be only vertical root fractures on. I may need to get another X-ray to look at J-shaped radiolucency because vertical root fracture, most properly, the pocket, guys, it actually starts from where? Okay, let's now ask this question to everyone. When you have vertical root fracture, do you think vertical root fracture it starts from the crown or it does start from the roots? Let's 10 seconds only. After, guys, this type of question is very important questions. Very, very important. These are the critical thinking questions you must learn for ADC exam. Okay. What do you think, our champions here on Zoom?
Usually starts from the base and goes all the way up.
Yeah, from the root, right?
Yes.
Okay,
Yes.
at this level, not from the crown.
No.
Yes. But think about it right now. Do you think if it's 7 millimeter only, is this an indication for vertical root fracture or more into deep crack from the crown subgingivally
Yeah,
to the roots?
you're actually very right. Might be
We
just
think, right? We just
vertical.
think as dentists, guys. You know what? For books, it's fine. We believe in books. We believe in the studies and all the stuff. But think about it clinically. Yes, Dr. Leary. If the fracture started from the roots from here, so do you think should be deeper somehow?
Yeah, definitely.
Or maybe it can start from midway and then goes up to here only. Like let's
Mm.
say could be as well. Like it starts only the fracture only starts from this level and then goes
Yeah.
up, and then that's why it's deep under this level, maybe. It could be. But most properly, for this tooth, it has started from the crown,
Mm.
right, all the way down to here. And maybe also, it starts from the root, just the mid root only at the level of 7 millimeter, like only from here, not deeper,
Mm.
and then goes up. It could be another possibility. Now, here is very important question. This question, guys, very important. We need to give 20 seconds, not only 10 seconds for this question, because very important. Out of the information we are having here right now, what could be the reason, the main reason of the vertical root fracture? What is the main risk factor? And what is the main risk factor for grinding? What is the main factor
You
for,
said it.
yeah, for no, for the other, no, for crack tooth syndrome, because crack tooth syndrome has different risk factor than the vertical root fracture, both different. Guys, when I'm saying different, when I'm saying the risk factor, by the way, listen to me carefully. If you're telling me, for example, grinding can result in crack and result in vertical root fracture, I tell you yes, but it has more effect in one of these than the others. So I need the most significant factor result in crack and the most significant factor result in vertical root fracture. I think everyone got now the 20 seconds. Yes, guys, my champion Zoom, tell me please.
So, Dr. Bito, from what I understand is that when you're constantly bruxing, it puts a lot of stress and it weakens the tooth and cracks
Thank you
develop. They
very
don't.
much. So now I got it. So now it's
Yeah.
crack, right?
Yes.
So
I
now
think.
the answer is very easy and simple. So now the most significant factor for the crack tooth syndrome is grinding, stress and grinding, right?
Yeah, but because there is a chronic sort of part, like no normal forces on the teeth as well.
Yes,
On the
extra
back teeth,
forces,
extra
right?
forces, exactly.
Unnecessary extra forces. Thank you, Dr.
And
Amna.
then
Thank you.
it's triggered by the popcorn, the naughty one.
Okay, 1 second here. Pop now. Let's now talk about what is the most significant factor for the vertical root fracture in this case. Only one risk factor.
The hard object.
We're waiting.
Yes,
Oh,
actually, Dr. Larry can say it or Dr. Andrella, because you already Dr. Amna said one. So
okay.
everyone need only say 1 point.
Okay.
Yes,
Just go, Dr. Cinderella. I like that.
Cinderella, Andrella, Cinderella.
I think there is caries. I don't know. I can see on visual side
And
that
on
can be a
mesial side,
factor.
yep.
Yeah, on that crack line, I can see that a blackish caries portion. Maybe that is.
Okay, but do you think caries will be able to result in vertical root fracture and so on, or you still need a trauma, very heavy force on the tooth that's be transmitted nicely from the crown all the way strong, like earthquake, an earthquake force, all the way from the crown to go down to the root to break it, an earthquake.
I think both.
Yeah, so what is the earthquake factor here? Very strong factor. result in that heavy forces on the tooth all the way from the crown, transmit from the crown to the roots?
The naughty guy, the popcorn.
The popcorn, right?
Mhm.
Agree on this?
Yes.
So now for
Yes.
vertical retraction, we need a heavy force. And the heavy force actually been made by the as Dr. Larry mentioned, the naughty popcorn, right? Good. Is that you said poppy, the naughty popcorn, or you daughter?
No, I do. You know, I have those stuff too. I'm a kid
Okay.
inside, Dr. Beta.
Okay, I agree on this. Okay, Dr. Andrella, do you agree on this?
Yeah, definitely.
Okay, that's very good then. Good job. Okay, so now guys, these are the risk factors. So the risk factor in this case for the diagnosis, one is actually the main risk factor for cracked tooth syndrome is a history of bruxism, grinding, and also for the crack, I would say the big filling as well, but the main is bruxism. Two,
Yeah.
the main risk factor or cause of vertical fracture is, as Dr. Leary mentioned, the um, the naughty popcorn, the unpopped. I don't know, it's not really because you popped
On popped, yeah,
like
that's
the other
true.
brothers and sisters, right? Yes, the whole
It
family. Why?
measures
The
popcorn.
evil twin that didn't pop.
Yes. Okay, very good. As if I'm strong. I don't want to be soft, huh?
Yes,
Like the popcorn
exactly.
say, I'm strong. I don't want to be soft. Okay, that's fine then. Okay, guys. So now, one finding here, 7 millimeter periodontal pocket depth only in one side. Most pockets means a deep crack into the roots, or it could be vertical root fracture has started at midway of the root going up to the crown. And maybe they meet each other. The deep crack meet the vertical root fracture together in one point, and that's why both of them result in bone resorption and the pocket dips at this area. Perfect. Now, let's come into the part that's most of the candidates really find a little bit hard, but let's really make it simple and easy to everyone. Here. Okay. Medical history. Patient who has an asthma on salbutamol. Guys, look, when I'm thinking about case, I'm thinking about relevant information for the case. Don't just manage salbutamol for another different dental condition. I don't want you to talk about asthma and salbutamol in cases of fluoride, for example, in cases like when you give fluoride, what total fluoride. I don't want to talk about asthma and salbutamol in patients with allergies. I don't know this. I don't want to talk about asthma and salbutamol in medical emergency cases. I want to only today cover the relationship of asthma and the case today, mostly the management today. So guys, if which point is the most important point in this case, you must cover for salbutamol. Maybe one only point. 10 seconds for everyone,
Controlled. Oh, sorry.
and then we can say yes, please. Okay, let me until they think about it. Guys, please, guys, think about that way. In exam, when there is a scenario, you must apply the capab shop and train station theory concepts. Okay, so now there's a case. The patient has an asthma and salbutamol. There is important point we need to cover here. Only one point, relevant point. Any other point not important to me. I know you're very good. You know about asthma, you know about salbutamol, you know everything about them, but maybe not important as the one we're gonna discuss. So yes, so we can discuss here our champions. You see, there's the champion say dry mouth. Very relevant. What do you think, Doctor? Yes, our champions here. In Zoom.
In this case, I don't think it's relevant because we're not discussing about caries.
Care is not relevant, right?
Yeah,
Good.
no.
But it's good. So now that's a good point. Let's see Dr. Amna now. What she's gonna say. Dr. Amna.
Mm, like what if they're using a puffer? So,
Yes, good.
chair position maybe needs to be considered.
much, but yeah.
Control, no control. Did you bring your buffer? Because
Good.
of
That's
your
the one. Okay, this
that's
is
it.
the one. This is the one. Did you bring your puffer with you today or not?
Yes.
Yeah.
Yeah.
That's the one I wanted. Why? Because it's gonna help in management today,
Okay.
right?
Yes.
Yes,
Or
control
tomorrow.
can be another second point, but the most, guys, why I'm saying this, because these are the things really you need to ask. These are the most important things. Anything else, wrong choice, wrong answer, wrong management. Okay, perfect. Okay, now rheumatoid arthritis, for which he has been taking prednisolone 20 milligram daily, for 4 years. 10 seconds, and please, guys, tell me what is the importance of this point. Actually, we have at least 3 to 4 important points in this part. At least 3 to 4 important points we must know. Okay, I think everyone starts right now. Dr. John has answered nicely. Okay, now as long as one champion has answered the Facebook, so now we can start here. Okay, who's guys want to start first with 1 point?
I give
Can I?
you
Okay.
guys a chance.
No, you go ahead now.
No, you go.
Okay. Then I'll give all three.
Give them.
That's fine.
Okay, so prednisolone 20 milligrams for 4 years. That's a long time. So there is definitely immune suppression.
Okay, thank you very much. Enough.
Okay.
One, immune suppression. Very good. Okay, now I will only answer this question to you because you opened this point. I will continue this point with you to end it together. Okay, immune suppression. Now, if there is immune suppression, how this can affect your management today? What gonna happen?
So we need to ask their doctor if they need
The
some.
treating doctor, the GP, right?
Yes, the one
Very
giving
good.
the prednisolone. Do they need anything prophylactically?
Okay, because this is gonna affect your decision for prophylactic antibiotic.
Yes.
How the GP will decide if require prophylactic antibiotics or not?
Their general health and if the RA is under control.
I'll
What
tell
is this?
you. I'm biting my tongue.
Sorry?
No, hold on, Larry, okay? Hold on, please. Okay. Yes, Dr. Anna, yes? How the GP can tell about if this patient immunocompromised or not? They can do something.
I don't know.
Blood test.
You got it.
Blood test, right?
Yes, of course.
Which,
And they do blood test on a regular basis, so they
what they gonna
already
look in the blood test?
the antibodies or I
No,
don't know.
antibodies actually for allergies.
I don't know.
White blood cells,
Yes.
right? So they
The
look at the
WBC
white
count,
blood
yes.
cells. Huh?
WBC count, yeah.
Yes, the counts, right? And see if it's low. Is it low? Is it normal?
Okay.
Clear? We covered the first point now. Thank you, Dr. Amna. We covered this one. So now the effect of long-term prednisolone, which is more than 10 milligram for more than
More
2 to
than
3
5 in
weeks.
the new TG, Dr. Beto.
Huh?
More
Huh?
than 5 now.
Yeah,
5
5 to 10.
milligrams.
That's okay. 5 to 10. Okay, guys, 2 to 3 weeks time. In this case, right, we end up with what? It can end up with immune deficiency. How we know it? GP. We need to discuss this with GP, treating doctor. What the GP gonna do? Blood test. What they going to look at the blood test? White blood cells. Okay, mainly. Very good. That's the first point here. The second point, in prednisolone. Dr. Larry, please.
So there is a high risk because of the dose and the duration of adrenal crisis if the patient is having an invasive procedure.
Okay. What exactly going to end up with adrenal crisis? Look, guys, let's discuss this together while I'm in the class here.
Stress.
Adrenal crisis, okay?
Yeah.
Here. So yes, please. Let's now go with every point. Yes, one with adrenal crisis.
So yeah, with adrenal crisis, basically I don't go into too much detail, honestly. I
No,
just
this
say,
is general information for everyone to
oh
understand
yeah,
in.
okay. So then with the adrenal crisis, if you got the corticosteroid sort of usage for like more than 5 milligrams for more than 3 weeks, then the hormone cortisol gets decreased, or kind of like you don't produce it too much in the body. And then if you have some sort of like stressful situation, which is not only like stress on daily basis, just within the body, then you might kind of like have tummy issues first, or you might lose consciousness, and the end result might be something life threatening, which is called adrenal crisis.
Very good.
And that's something that we want to avoid, and it can be prevented. So how are we going to prevent it? Usually we need to consult the GP, check if the patient has any dosing strategy, or like double the dose, usually in the morning of the appointment.
Good. That's very good then. So so the dry crisis is when the patient taking a long-term prednisolone, this will actually suppress the body's natural stress hormone, the cortisol production from adrenal glands. And then in this patient, the adrenal glands may not respond adequately when the body
Yeah.
needs cortisone under any stress, like
Yeah.
extraction. This is, as guys, the pathological stress. We call it this way. And this will result in dangerous, life-threatening drop in blood pressure. We call it adrenal crisis. So when the blood pressure goes all the way down, this is now adrenal crisis. What sort of signs are going to happen? One, I see right now, severe low blood pressure. Patient may collapse. Where about it's happening? Is it happening in the clinic most likely, or it happens at home? Most
It can
likely it
happen either.
happens when?
Both. It
Where?
can it can happen
Most
in the
likely, if
chair.
the patient, for example, like during the procedure can happen, but at the same time, even at home and even when the patient's sleeping, that's why it's very important.
Very good. Yes, Dr. Anna as well. Tell me.
Yeah, same. It can happen in the chair, or they can have an episode afterwards.
But most likely,
In the clinic, I would say.
no, at home
No?
after 6 hours.
But they're going through the stressful procedure in the clinic.
Yes, but it takes time to the body to respond to it.
Okay.
At
Yeah,
home
because the
after
patient
six
has
hours,
the
after six
patient
to
taking.
12 hours even.
If the patient has taken like only one dose, we usually double the dose before any stressful procedure. But if the patient we don't take any precautions, then it's normal dose, and then the patient can have that afterwards as well.
Yes.
Okay.
Okay, that's totally true. So the signs, symptoms will be as sudden weakness, nausea, vomiting, diarrhea, confusion, loss of consciousness. That's why we need someone to escort the patient and stay with the patient tonight. And then if this person find out any of the signs, symptoms can happen to the patient, he should call straight away. Who should call? A dentist or who?
Mm,
Triple
mm,
zero.
Triple zero straight
Emergency.
away.
Yeah.
Right? Right, Dr. Andrella? They
Yes.
call triple zero straight away, Dr. Andrella, okay? Because this is life-threatening condition, not easy condition. Okay. Is that guys clear, guys, this protocol? That's why, okay, let's just guys go in the management part. Let's summarize the management part. In a drug crisis, one, contact GP as here and discuss with GP about
The
Immune levels,
yeah.
dose
dose, and
for a drug crisis now. We just
Duration.
for the stress,
oh,
right?
sorry,
No, the
adrenal
dose.
crisis.
No, the dosage for corticosteroids for the
Yeah,
treatment.
yeah.
And when exactly? The dosage can be in the same day of the treatment, which is the morning. Some doctors still believe we need to give it at night as well. So they normally think about that. This is what the GP should tell you. For example, if the treatment will be tomorrow morning, because normally we like the treatment to be next day morning, some GP will tell you, give 1 dose tonight before they sleep, and 1 dose before 1 hour before the procedure. This is some GPs say this. Other GPs say no, only give double dosage 1 hour before the procedure. Depends on the GP. So that's one. Second one is the treatment should be done in the morning. This is the best time, the morning. Third one is the patient should get someone to escort him and stay with him the whole night if possible. Why? Because this person will be able to tell if the patient start to feel dizzy, if they start to collapse. In this case, this person should call 000 straight away. I hope, guys, it's clear now to you about the management this part. Is that clear,
Yes,
guys, to everyone? Yep. Good, good. So by this way, do you think this patient, if we're going to do extraction, do you think should we do extraction today?
No.
I was gonna say hell no.
I don't think so. I don't think extraction today. Okay,
Will be
very good
risky.
then. Okay, Morange.
Yes.
Let's now talk about Morange. Morange is straightforward and easy now. Patient
Oh,
take
yeah.
osteoporosis and bisphosphonate tablets, right?
Mhm.
Now the patient, what this can result in? Osteoporosis and bisphosphonate.
High risk of, sorry, 10 seconds.
10 seconds. Very good. Yes, we can start right now.
So the patient is already, might be
Yep.
immunocompromised,
Yep.
and it might result already in a high risk of developing
Yep.
Morange.
Orange.
Yep.
Yes. And
So
they will,
Morange.
yeah.
Okay, now, Dr. Amna, because
Yes.
Dr. Larry already mentioned about 2 points right now. You, Morange. What is Morange exactly?
It's sorry, I'm sorry. It's basically when this medication, the osteoporosis, it affects bone remodeling in a way that it it healing doesn't happen as it should. So the bone gets exposed, and at that area, it's very painful. The wound site.
Okay. Oh, where is the Morange gone? I have Morange already here. Yeah, Morange is here. Yes.
So the
So,
bone remodeling is happening at a faster rate in osteoporosis patient. It slows it down.
okay,
The
make it
this
easy and simple.
yeah.
Severe type of inflammation happening in the wound area. Why? Because incomplete healing, right?
Yes.
This will happen mostly or confirmed after 8 weeks of the treatment.
Mm-hmm.
So what
Because
is this?
at the beginning it's not Morange. Like at the beginning it's just delayed bone healing because of the medication.
Yes, but find it's inflammation at the beginning, right?
Exactly.
It's just severe type of inflammation
Yes.
in the wound or around the wound, in the bone or soft tissues, both together, not only soft tissue, not only bone. And this happened because incomplete healing, right? And this is going to be confirmed after 8 weeks of the procedure of the treatment. True?
Yes.
Why this is happening exactly like this? Because bisphosphonates slow down the bone breakdown, right? And then this is strengthening the bone because of osteoporosis, but reduces your ability to heal after surgery.
Mm-hmm.
Why? Because less blood supply. Okay?
Yeah.
Now, Morange happening, what can happen? Exposed, non-healing bone. And not just only the bone, also soft tissues. And the jaw, persistence more than 8 weeks after dental procedure. Okay. Now, do you need to prescribe antibiotics for Morange in the first instance?
No.
No.
Oh, sorry. 10 seconds.
Okay.
I'm so sorry.
That's okay. Yeah, we can start right now. Do we need?
No.
No, I don't think so.
Okay, when exactly you may need, okay, Dr. Larry, when exactly, Dr. Oinrella, when exactly we need to prescribe
Yes.
antibiotic in these cases?
There is any sign of infection?
When the sign of infection, can guys please everyone classify to me, Morange, how many class do you have in, how many stages or class, the way you want to say, or how many grade?
Good question, Dr. Peter. Think 4 or
Yep.
5?
Like 0, 1, 2,
I
3,
think 4 or 5.
I think 5.
5? Are you sure 5?
4 or 5?
I read somewhere 4.
Sorry, Dr. Widow, I didn't hear you. Phone network interruption.
Okay, there's a classification or staging or grading from range. And I make it easy to you, it's from 0 to some number, like 0, 1, 2, 3, 4, for example. Everyone
Okay.
has its own management. 0, nothing, just a little bit of
Yeah, I
maybe no
think it's
eating.
4.
Okay, huh?
I think it's 4 from memory. 4 or 5. I think it's 4.
Yeah.
5 is too much. For who you can get 5 then?
4. 4 is, I think it's 4.
Can we tell me the 4 then? If they actually 4, not 3, if not 0, 1, 2, 3, for example.
No, 3?
Tell
No,
me
I
now.
think it's 4.
I read them in part 1 and
Everyone now, I think they open TG quickly to look at it.
No, so exposed bone, then there is exposed bone with no symptoms. Then there is exposed bone with symptoms. And then there is exposed bone. Oh, there might be 3, maybe?
Yeah, that's what I'm saying. 0 to 3 or
With
0 to 5, 0 to 4.
with some other features like infection. Maybe 3 then? I don't, yeah, sorry, I haven't gone back to the staging lately. I'm so sorry, I apologize.
That's okay. But I believe the champions know now on the Facebook and they
Oh,
can say right.
they must be all over it.
I'm sure. Let me check what they're saying. We get this and check now what they say.
Good revision.
Who say what? What they say?
I said good revision.
Yeah, they will. Definitely do. And they
Not
will
for
have it.
me.
You see? Okay, guys, everyone, guys, please, guys, give big, big, big heart to Dr. Shraddha, guys. How I can give you good heart, Dr. Shraddha? Yeah, it's here. Thank you, Dr. Shraddha. Okay, guys, please, guys, everyone, guys, please give big heart to Dr. Shraddha post. And you will know right now, okay? So, guys, 0 to 3, not 0 to 5, not 0 to 4, 0 to 3, okay? Like 000, okay,
Well,
guys?
when I was remembering, then I remembered right.
Yes, they are 4 together, but there's 0 at the beginning, okay,
Yeah,
guys?
yeah.
So we know exactly we need to give antibiotic in stage 2. Class 2 or stage 2, grade 2, okay, guys?
Perfect.
Stage 2, we need to give antibiotics. 0, 1, we don't give. 2, 3, yes. Okay, perfect then. I think we're done with this one as well. Pain management in this case. Okay, guys, let's decide now on the pain management. Tell me, please, guys, what sort of painkiller? If it's, let's decide this way. Please, guys, no one answer except after 10 seconds. If the pain is moderate type, if I'm going to say to doctor, if I'm going to say, Dr. Amna, it's just a little bit of pain, doctor, it's no mild. It's just like mild pain only, doctor. It's not very, very much, doctor. So what going to be
the
the
choice.
painkiller?
Yeah.
And if it's moderate, what can be the painkiller? And then if it is severe, if I say, no, doctor, I couldn't sleep last night, So what could be the painkiller? Okay, let's start now. I think everyone got, please guys start now with mild. What is the painkiller, guys, mild in this case? Yes, please, Dr. Anna, Dr. I think we can start now with Dr. Cinderella. If it's a mild pain, Dr. Cinderella, which painkiller? If you want to say, please.
Ibuprofen.
Sorry, yep, which one?
Ibuprofen, doctor.
Mild, in this case, will be ibuprofen. There may be a
Yeah.
trouble here a little bit. Okay, I look, ibuprofen can be, but a little bit of trouble because of one thing here or two things.
Then naproxen.
Because of cortisone,
Naproxen.
right? Yes, very good. And because of aspirin.
Yeah.
Yeah.
So if it's not ibuprofen, what else it can be, Dr. Andrella?
Naproxen, naproxen, safe.
Paracetamol, very good then. You're totally right. Paracetamol, okay?
Yeah.
Paracetamol,
Thank
perfect.
you.
Very good then. Good job. Okay. Okay, Dr. Amna, Dr. Larry, paracetamol, what is the dosage for paracetamol?
It's 1,000 milligrams for 6 hourly.
Yes, 1,000 milligram. Okay. If it's moderate, Dr. Larry.
Mm-hmm. I think we had this discussion. So, depending on, like I would ask, have you taken ibuprofen? Because ibuprofen can be taken for short doses and it's not going to be that,
Yep.
severe on any health effects, I would say. So if it's only until tomorrow, it's less than 24 hours, that would probably be an option. But since I'm consulting the GP, I will probably consult if it's safe.
Okay, you may consult GP about this one too. You're right. For the benefits, true. But if the examiner say, for example, there is no GP around, it's only a decision right now. What are you gonna prescribe?
Well, we can prescribe oxycodone if it's
For moderate or severe?
moderate to severe. Yeah.
Moderate to severe, right?
Yes,
Okay, let's
absolutely.
say if it's just a mild, do you agree paracetamol is enough and that's it?
Yes, correct.
Moderate, what you can do as a moderate, you can increase, you can tell the patient to take another, maybe one more paracetamol, right? They can take it maybe every 4 hours and then see if it's gonna work or not. Severe, what you gonna do then?
The oxycodone.
Yeah, we can
Oxycodone, right?
do a
Just
combination
one.
of
Yeah.
paracetamol and oxycodone.
Yes, one paracetamol, one oxycodone before they sleep, only for tonight until tomorrow. It's only
Yes.
one night, and that's it, just in case,
Yeah.
right? That's it.
If it's severe, which I still have my, my reservations about severe pain in these cases, but you know me.
So
Look, uh, let's say if it's just
I'm
only
open.
vertical
I'm
root
open.
fracture.
I'm
Look,
open to it.
yes, if it's vertical root fracture, the classical sign is, we call it as chronic,
Yep.
dull,
Yeah.
mild pain. This is especially happening with biting or because of inflammation, because the food impaction there. That's
Absolutely.
it. Normally coming from the gums and the pocket.
But we never know if
Never
they
knows.
throw at me that they have severe pain. I'm open. I'm open.
Maybe because of the crack itself. Who knows? Maybe.
Yeah,
We need to
exactly.
be ready in any other circumstances.
Exactly. Absolutely. I agree.
We don't know what's gonna happen. Okay. Yes, but clinically, yes, vertical root fracture clinically, it has mild, chronic, dull ache pain. That's it. Because it is more into soft tissues rather than pulpal tissues.
Mm.
Okay. Soft tissues coming from the periodontium. Okay, guys. Now, oh, by the way, guys, let me tell you something. I just remember right now. Tomorrow that will be part one, our part one champions. And guys, for everyone asking for the crash course for part one, we're gonna start after 2 weeks from now. But you can join the course now and you can attend this 2 weeks for free. I'm just remembered right now. And for part two, we have our technical class on Thursday and Friday. Our technical class for part two on Thursday and Friday. Just remember. So because people keep asking me. Now, who's going to do this role play? Is that
I
Dr.
think,
Anna
yeah,
or
I can
Dr.
do it
Larry?
if
Because Dr.
everybody
Larry
else
can
is.
do one last
And
time, right?
I did last time, so
Yes,
I
so
think
Dr.
Dr.
Anna did.
Amna should take a shot.
Dr. Anna, look, things now is too easy. We discussed every single point in this case, right?
Just one
Then,
more thing.
huh?
Just one more thing. Can we
Yes.
put flow on top?
Yes, you can put flowable component over here. I found it to you now. What you need to do is paracetamol if this is, and then oxycodone if this is, and then I put it here somewhere. Uh, where about it? Yeah, here, temporize. Do nothing except advice. That's one option. I like it. Why not? Pain management only for tonight. And then you can put GIC composite to seal the top, maybe flowable composite to seal it. And then no extraction for today. Maybe you can put stainless steel band around. If you ask my opinion, I would say that's only what you can say, the first one. If they ask what else, you think about any other options, you can say this. If they ask what else, you can say this. But make things simple and easy as much as you can every case. Okay?
Okay.
No problem. Ready, ready, ready?
All the
Yes.
best, Dr.
Oh,
Amna.
thank you.
All the
Thank
best.
you. Thank
Look,
you.
I want you to answer me only one line, no more than one line. For example,
For
if I
every
ask you,
question. Okay.
yes, for every question, if I ask you, if Eden explain something to me, daughter, why you cannot do extraction today? Don't keep explain everything about the books. Okay, because I need to contact GP first because you are taking two type of medications. That's in double check them with them or with the GP. The first one is because you are on prednisolone, and the second one because you have you know what, even osteoporosis not even important because you are on prednisolone. What do you mean, doctor? Because prednisolone, it's a medication that it may slow down your stress hormones in the body. That's why we may need to increase the dosage before the treatment. So the GP will be the best to tell us about it. Okay, doctor, so when the extraction gonna happen? Tomorrow morning, after contact GP. Do you get my answer?
Yes.
Please don't answer more than this to me. Okay?
I know. And Dr. Vito, in exam,
Mm.
will we get X-ray with this?
Maybe yes, maybe not. Who knows?
Okay.
Everything possible in this life.
Mm.
Okay?
Okay.
Okay, no problem. Okay, let's start. 3 minutes reading
James. Yes. Okay.
or 2 minutes because you already have enough information.
Okay.
2 minutes. All the best with the doctor.
Thank you. Yes, I see the timer.
Okay, guys, Dr. Amna, why she's reading the scenario. So, guys, um, again, the session, guys, is our sessions tomorrow for part one champions. And then for everyone, guys, waiting for the crash course or texting me for the crash course. We're gonna start crash course in 2 weeks' time, but you can now join the course, guys, from now. And this is will be even advanced to you. And our part two champions, our class, our technical class will be on Thursday, and Friday will be the assessment class for everyone. So Thursday and Friday. Thursday will be at 8 p.m. Sydney time, and then on Friday will be 7 p.m. Sydney time. And Saturday will be, I think we're gonna have something happening on Thursday as well. Saturday. Please cover the both parts for me only, okay?
Okay, and I'm gonna assume that I didn't do an X-ray.
Yeah, whatever you like. I'm happy with
Okay.
anything. Okay, you just need to do this, whatever findings provided to you, verse one word, like word by word, not too much. Okay, you can start right now, please. All the best.
Okay. All right. Thank you, James. You were very patient while I was having a quick look inside the mouth. I did some examination and I took some
Sorry,
photos.
doctor. Sorry, doctor. What's your name again?
Yes, I was coming to that. As you know, I'm Dr. Amna, and I will be the one taking care of you today. And is that okay?
Thanks, doctor. Thanks, doctor. Doctor, look, yesterday I was eating popcorn, just sitting, watching TV, and I bit down on a popcorn, a kernel one, that didn't pop nicely. And then I felt this terrible sharp pain in my back tooth. Since then, it hasn't stopped. It is hurting when I bite, and even just sitting. There is throbbing type of pain.
Throbbing. Okay. And it's been there since yesterday.
Yes, I couldn't sleep last night because of this pain. Sharp pain, very sharp pain, terrible sharp pain.
Did you take any painkillers to help?
Yes, I took Panadol, but it didn't work, doctor.
It didn't work. Okay. And you're saying that it started after you bit on this hard popcorn. Okay, I get it. Now I've done this, done some examination, and I would like to discuss the findings with you. Now let's first look at the photo together. Okay. Now this is your tooth, and I took this photo, and as you can see that I see there is a crack line. There is a very visible crack on the tooth.
Yes?
Yes, so it seems like when you bit on that hard popcorn, you fractured the tooth.
Okay.
Yes, so
Doctor, why this crack has happened then? Do you think this is a crack has happened because of the popcorn or something else?
yes, it did contribute to that because there was some very high biting force exerted. However, there are also other things that contributed to it, the crack.
Perfect. Like what, doctor?
Okay, so I see in your I see it. Sorry, do you have a habit of grinding your teeth? Because I see some evidence of wear facets on the teeth.
Doctor, I already provide this information to you, to your practice manager this morning, and then I believe even you asked me about it before, and I said yes. So, doctor,
Yes,
please, doctor, can you read the notes in your screen, please,
yes,
doctor?
that's why I was asking. The
Don't ask me
card.
again, doctor, please. If actually, if I give you something before, do please ask me about again.
Okay, I
I'm very
apologize for
busy,
that.
by the way. I'm very busy person. I have only 10 minutes here to go, okay? And then after this, you will not find me. So please, doctor, don't ask me anything
Okay,
you already given me
let's
before.
get to the point then. Yes, the card that was provided to me says that you grind your teeth.
Doctor, what do you mean by getting the point then?
Why
You
the
mean
crack has
like I should
happened?
stop then? I should be silent and stop then?
No, no, no. You said you didn't have time, so I said let's get to why this has happened.
Because I thought, doctor, when you told me that you need to get on the point right now, that you actually pushing me to stop. Okay, I don't like me the way I'm talking. Okay, doctor, yes, please, doctor, keep going then.
Okay, so the history that has been provided to me, it indicates that you're grinding your teeth. Are you aware of that?
Yes, because I told you, doctor, I told you
Okay,
about 5 minutes ago.
so that grinding is contributing to these wear facets and the crack that has developed because it is exerting some very high forces on your teeth. Okay.
Doctor, what is wear facets, doctor?
Sorry, signs of the teeth wearing away. You know, your teeth are flattening out
I
in
don't
these
know this,
areas
doctor. Sorry, I'm not a
as you can see in
dentist.
these pictures, in this picture, you know, the
Okay,
teeth are a
I
bit
see. Yeah.
flattened.
Okay.
Yes. Also, you're going through some personal stress, which can also contribute to the development of this crack. Because a lot of people they tend to grind more when they are under stress without actually being aware.
Doctor,
Okay.
I'm really very stressed, doctor. How can I manage my stress then?
Okay. So the stress can be managed by, you know, you can talk to me, or you can talk to your GP about it, and they can help you better
Okay,
manage it.
I'm talking to you now, doctor. How you can help me then?
Okay, so sorry, what are you stressed about exactly?
I'm stressed about everything in this world, doctor. I'm stressed about my work. I'm stressed about my husband. Sorry, I'm a man. I'm stressed about my wife. I'm stressed about my kids and everyone.
So, work-related stress, you can, take it up with the people at work, and the family, you can always talk to your family about it, how you can resolve that.
Okay, didn't work, but anyway,
Okay, so let's get to the photo, and then we can talk about stress in the end. Is that okay?
not okay.
Oh no. So you want to talk about stress?
Why? Oh no, why doctor say, oh no? Oh my God. Seems like you don't like
Because you have 10
participating.
minutes only and 5 have passed. Yeah, that's why.
No, okay. I'm not happy,
If you have
doctor.
more time, then I'm happy to help.
I'm not happy now.
Okay, so what would you like me to do?
I just need to help me with my stress. And please, doctor, I feel like now I'm a person who's not good person. Now you put me down now, doctor.
I'm sorry if I made you feel that way.
Okay.
Okay. So this stress is contributing to the grinding habit, which is contributing to this development of this crack that has happened on the
Okay,
tooth.
doctor, how can I manage my stress, doctor?
Okay, so like I mentioned, if it's work-related stress, you can take it up with probably your manager at work, let them know about it, and they can manage it for you, help you manage it.
Okay.
Yeah, or you
Any
can
other
talk,
thing?
and you can talk to a therapist if you like.
Okay.
Yeah, these are some
Okay,
very good
doctor.
options. They can be very helpful.
Okay, doctor, I'm taking Ventolin for my asthma, doctor, and other medical medicine as well, doctor. So, what do you think?
Okay, so Ventolin, are you taking it in the form of a puffer?
Yes, it's a papaya.
Okay, and do you carry it with yourself? Have you brought it along?
Ah, yes.
Okay, so it's best to carry it with yourself so you can take the puffer whenever you need to. Other than that, I see in your medical history card that you're also taking some medication for your arthritis, right?
Yes.
Yes. So, is the arthritis being managed well? Like, is it under control?
Ah, yes, I take Fosamax, doctor. Yeah.
Okay, so the medication that you're taking for the arthritis, it is very good for your arthritis. However, if it is taken for a long time, sometimes it can slow down your immune system. Okay, so if we need to do some sort of treatment for your tooth, for example, if I need to take out the fracture has extended all the way along till the root and I need to take it out, I need to consider the effects of this medication. I need to ask your doctor if you need some antibiotics before that to reduce the chances of infection.
Okay.
Yes. Another thing
Infection.
is,
Mm,
yes.
okay.
Yes, another thing is that the prednisolone, if it is taken for that long, again, it can have some effect on some of the glands in your body, and it can put you at a risk of a condition called adrenal crisis. Okay, that is a condition in which if you go through something stressful like dental treatment, you can have some symptoms like low blood pressure or some confusion. So, in order to avoid that, sometimes we need to adjust the dosage of the medication. Has your doctor ever talked to you about a dosing strategy or a dosing plan?
I don't know what these two words, doctor. Sorry, I'm just a patient.
That's
I'm not
okay. I will talk to them for you, and maybe they will increase the dose of the prednisolone before we do your treatment. Okay?
Okay. So,
Yeah.
doctor, what is this a drug crisis you said now?
Yes. So it is a condition in which there are some hormones which are regulating certain parameters in your body, like your blood pressure and your sugar level. If you take this medication for a long time, the level of the hormones can be reduced in the body. So, in order to make up for that, we increase the dose of the medication. It's as simple as that.
Okay.
Yes. And I will talk to your GP. Let's see what they have to say about that. And then we will reach
About what?
about the dose adjustment of the prednisolone.
Time's up. Thank you very much. Dr. Amna.
Yes.
Okay. Why you make me upset?
Did I say something
Why
very
did why
offensive?
did you make the patient upset?
I don't know, Dr. Vito. You got offended. I don't know why.
Sorry?
You got offended in the beginning, right?
Yes, because I'm a patient. I really, what you told me made me offended, definitely, because I'm a patient.
But what did I
A
say? That
dentist,
was
a
so
dentist, a
wrong.
dentist should, a dentist should be more nicer than this, right?
I thought I'm nice, but okay.
No, as a dentist, no, you haven't been nice as a dentist. As a person, no, I know you very much. I know who you are, Dr. Amna. I know you are a very nice person, right? But as a dentist in this role play wasn't nice.
Can we do it again, please, quickly?
No,
Please,
no, no.
please.
Okay. You sure?
Yes,
Do you want
yes.
to do your issues first or like the
Do
things
it,
need to be?
Dr. Peter. Do it again,
I
please.
will, I will. That's why I said that's fine.
Again, please, Dr.
Okay.
Widow.
But do you want to know first what you have said?
Yeah.
Tell me what did you say first? Because I don't want to repeat again.
I didn't introduce myself first. That was
No, this is not the things made me upset. This is something it's something to build up rapport, but didn't make me upset.
um hmm, I said something about you grinding your teeth and I don't know.
Sorry to
Okay,
interrupt.
please.
So basically, if there is something given in the scenario, just confirm it because
Oh, okay.
that makes the patient really upset.
Okay, 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 got it.
Okay.
And
You
that's
remember
like
when you told me?
I will
Yes.
I will not confirm it. I will not repeat it.
Okay. Do you remember when you told me, oh no?
Oh,
And
yes.
then you told me, let's focus on like this. Oh no is very bad one, by the way, to say to the patient.
I
When
said it
I said
because
something to you and said you said, oh no. When I said no, doctor, I'm not happy with this, I said, oh no.
okay,
Okay.
okay.
So please be careful about this, please, okay? About this stuff. And also when you said to me, when I was asking something, you said, okay, let's discuss this later on. It means like you neglect me.
Dr. Vito, 5 minutes had passed.
I don't care. Patient is patient.
Okay.
We don't care. Make the patient happy. I don't care.
Okay.
Do you want to pass or not?
Yes, yes, please.
Patients first, not you first. You're only gonna pass if the patient is happy. That's it. Keep this in your mind. Not to cover the case. Easy?
Mm, yeah.
Make me happy.
Okay.
Okay. By the way, you have
100%,
uh
100% right. 100%.
I you want to cover the case and I'm upset. Definitely, I will die my reports. I was upset. I'm not going to see this dentist again. You failed already. Do you get my point?
Yes.
Very good. Let's do it again.
Mm,
Let's start. Start straight away, okay?
okay, so you're gonna
Yes.
put the timer.
Yes, you can start right now.
Okay. James, as you know, I'm Dr. Amna, and I will be the one taking care of you today. Now, you've booked in the emergency appointment because you're having some pain in your lower back area. Would you like to tell me a bit more about it?
Yes, doctor. It's not really very severe type of pain. It's just a little bit of pain when I chew on the tooth.
Yeah.
The pain was in the beginning, in the last few weeks was actually severe pain, but today it's just a little bit of more discomfort rather than pain. Paracetamol works fine for it. I take one every 4 5 hours, and it works fine, doctor.
Okay, so it's settling and the painkiller is helping you. Okay, that's good.
Yes.
Okay, so I see here that you bit on something very hard, like an unpopped pop kernel. Did the pain start after that?
Um, yes, that was about a few weeks ago, like about 3 weeks ago, doctor. Yeah.
Okay. Thank you for letting me know that. And I also see here that you have a habit of grinding your teeth. Now, why I'm saying that is that I've taken a photo, I've done my examination. Okay, I've had my instruments and and I did some examination and I took some photos. Now let's look at the photo together. Now, as you can see, one of your back tooth has a very visible crack.
Yes, I see this in the photo, doctor. Yes.
Yes, this is a visible crack, and you've cracked this tooth. And both of these things, the
Doctor,
hard
what does
object
it mean by crack?
crack is basically like the tooth has a kind of split.
Completely. Crack means split or something different, doctor?
Crack is like a fracture, you see, and it can
Okay.
go all the way uh, to the entire length of the root, to the entire length of the tooth, or it could be superficial as well. Or we can have both of these as well.
Okay.
Yes. So right now on this picture, we see that there is a very visible crack line and the both the grinding and your biting on that hard object has contributed to that. Okay.
Okay.
Yes. And also there are wear facets which again indicate that you're grinding. Now this is why you're having the pain because when I examine the tooth, right next to the crack is a very deep pocket,
Okay, doctor. Doctor,
which is indicating, yes,
doctor, yes, doctor, I'm really under too much stress because the prices and the cost are now getting very high. Lots of loans and lots of things happening around and the war and stuff. I'm very stressed, doctor, right now. That's why I'm grinding.
yes, exactly. Your stress is contributing to the grinding, and the grinding is causing these cracks to develop. Okay. And if you bite, which weakens the tooth, and if you bite on something hard, the crack can extend all the way and then cause you pain. And this is what is happening here.
Okay, doctor, can you help me in any way with this stress?
Yes, I can write a referral for you, and you can talk to your GP, and they can help you out with the stress management and point you in the right direction. How does that sound?
Okay, doctor, we can do this, no problem.
Yes.
Okay, doctor, so what are you going to do today then?
Okay. Now you say that the Panadol is helping you. Keep doing that. Hello?
Okay, yes,
Yes.
forever.
No. So, can you tell me how you're taking the medication?
As I told you, I take one pill every 4 5 hours and works fine.
So you're supposed to take 1000 milligrams, okay, which is normally the pill comes in 500 milligrams. So you're supposed to take two pills, 4 to 6 hourly, as you need it. Okay.
Okay.
Yes. So other than that, the tooth, it needs to go because the crack has extended all
Where,
the way.
where about the tooth gonna go?
Sorry, it needs to
Party?
be extracted.
Extracted, okay.
Yes. However, we cannot do it today because you're taking some medications that need to be considered. Okay, let's
Okay.
discuss them one by one. Okay, this is your medical
Okay.
history card. And right now, you're taking medication for asthma, RA, and osteoporosis, right?
Yes.
And you're also taking Carcia. Sorry, what are you taking the Carcia for?
And just my friend advised me to take one pill every day. He said to me, that's gonna make you to live longer.
Yeah, just try and take every medication with the consultation of your doctor, please. Other than that,
Okay. Are you
yeah,
sure about this?
yes, of course.
Okay. Why
Mm.
this?
Because they can have some side effects on your body, and yeah.
Do you think my friend did something wrong to me then?
No, I'm not saying that. I'm just saying that any medication should be taken always in consultation with your doctor. They know what's best for you.
Okay.
Yes. So the asthma, the salbutamol, you're taking it in the form of a puffer.
Yes.
So, do you carry your puffer with yourself?
Yes.
Okay,
Yes.
so that's good. So when you come for the extraction, please bring it along so you can take it whenever you need to. Other than that, the arthritis medication that you're taking, you've been taking it for around 4 years now. Okay, so there are two things that need to be considered. One is that it can slow down your immune system. Okay, so you might need some um, preventative medication like some antibiotics, which I will discuss with your treating doctor if you need that. Other than that, it can also slow down some of the glands in your body which are producing some hormones which are regulating your sugar and your blood pressure. Okay, and this can result in a condition called as adrenal crisis. Are you following me, James?
Yeah, yeah.
Yeah. So in
So,
order to
doctor, what we need to do? What are we going to do
yes.
exactly?
So I need to have a word with your doctor again. I need to consult them and ask them how they will adjust the medication before the procedure.
When's the procedure gonna happen, doctor?
We can do it tomorrow and also in the morning.
Okay. Why
Yes.
is it?
Because any complication such as the one that I mentioned can be dealt during the day.
Is that no because the morning treatment is less stressful than any other time on the day?
That really depends on you, you know. Morning treatments can be less stressful for some people and not for the others. So, yeah, but anything at all.
I mean, like generally, because I have read this in an article before. I was reading in a newspaper. They said like people should do dentist in the morning because less stressful. Is that true or not?
It can be true for some people. It can work for some.
Okay.
Yeah. And also, if there is any complication, sometimes the complication doesn't happen during the procedure, it happens afterwards. So, we need a good window. It gives us a good window to deal with during the day. Okay.
Okay.
Yes. And other than that, I would like for you to bring somebody along, excuse me, somebody along who can be with you during the day and also then during the night. If anything at all, they can straight away take you to the emergency.
Okay.
Yes. Okay. Then you're also taking medication for your osteoporosis. And is that being managed well?
Yeah, seems like yeah.
Okay, so you've been on the osteoporosis medication also for a while, and so which can put you at the risk of another complication, which is called hemorrhage.
Okay, what is this umraj?
Hemorrhage is when basically like the medication, it slows down the healing process, and sometimes it hinders the healing process, and you don't heal the way you should. And there is
Should I take antibiotic for this?
okay. No, I don't think you need the antibiotic right now.
Okay.
Okay, sometimes hemorrhage is already present and it is just
Doctor, did you
unmasked.
tell me before there was a pocket and there's a deep space between the tooth
I
and the
did that.
gums? Did you
I
tell
did.
me this?
Yes, I did. Correct.
Okay, what does it mean?
It means that there is inflammation happening and there is breakdown of
Did you
tissue.
tell me there is a vertical root fracture or not?
No, I did not. I don't think I mentioned that. But
But why you should extract the tooth then? Keep going, keep going, keep going, keep going, keep going. Don't stop.
Because yes, there is a vertical root fracture and the crack has extended all the way along the length of the tooth.
And this is the reason that you need to. Can you save the tooth?
No, the tooth needs to go.
Why?
Because it has extended all the way, the crack.
And the vertical root fracture, right?
Yes.
Okay, thank you. That much better. Thank you, Dr. Amna. At least this time you've been nice. It's been against me, except only in one point, by the way.
Which one was that?
Which one? The one you told me about my friend. What did you tell me about the friend? When I said it's my friend, you said something.
No, you said that you're taking medication because your friend told you to do so, and I said that you should consult a doctor.
No, but you said something about the friend. You said something. It was like, no, this one and the other one as well. About the morning time. Try to be always, okay, I tell you something, okay?
Okay.
When you talk to the patient, try to be always positive, positive. If the patient says something, say yes to them, especially if it's correct. Like the morning, what's wrong with the morning? Why you complicate it? Why do you say some people, some people? As a general rule, morning treatment is less stressful than the others. Am I right?
Yes, but Dr. Biro, about the adrenal crisis, it's done to give you like that 6 hour window, right?
Yes.
So that it can be dealt with during the day. Any complications can we have a good window to deal with them.
But why we do treatment in the morning? What's the reason by this, Ramna? Mainly, why we do it?
I
Because
thought
less
this is the
stressful.
reason. Okay.
It's
Okay.
less stressful. Okay, you can like for many people, people with dementia, people with some other medical conditions, people under stress, kids even with some medical condition, we prefer to get them in the morning because it's less stressful.
Yeah. Okay.
Okay.
Yeah.
Okay.
This is a very long case.
Yeah, don't worry about how long it is, as long as you be nice with the patient. And what I felt first time is you don't care about me, you care about finish the case. Do you get my point?
In the second attempt,
Was much better. I haven't been that much.
okay,
I
we
haven't
can
been
do
like doing
another.
this what you said in the first. What?
Let's do it again.
Are you sure? That's okay then, okay? No, the second time it was
I
good.
think everybody will leave. Let
No,
them
no, no. You did it very good. You did very good.
No, we are
You cannot be
enjoying.
perfect. You cannot be perfect, right? No one can be perfect. So don't
go.
look for perfection. That's why maybe that's one of the reason why being stressed in the first time and being against me because I felt you want to be perfect, you want to finish the whole case. You didn't care about me. You only cared about the case itself. Did you get my point?
Yeah.
As if let's finish now. I don't care about your concern. I don't care about your stress.
So, but what happens, Dr. Biro, realistically speaking, if this comes in the exams?
Realistically speaking, what you need to do is you need to manage the patient, show them some
Empathy.
empathy. Say, I feel your stress. I know it's hard sometimes when you get in these situations. You know what? Tell you something. Have you tried to do some? And then talk about something, breathing in, breathing out. Have you tried? You know what? I'm here for you today. I know. Did you try to do some yoga, for example? I've heard yoga have read that something. What things can make you feel nicer? Do you think like for me, you can say example. For me, I like cooking very much. When I cook, I feel less stressed. Do you feel something else as well can make you less stressed? Ah, okay, don't worry, I'm here for you. How does it sound to you? Don't tell me. What did you tell me at that time? You told me,
I will write your refer to this.
no, no, the first time wasn't even like this. The first time I said, let's talk about this one.
Yeah,
We'll
later.
talk about this at the end. I said, what? Like as if my stress doesn't mean anything to you. You only care about the tooth, you don't care about me as a human. Where
Yeah.
is the patient-centered care then?
Hmm.
Patient-centered care is something very, very, very important in Australia. Okay?
Okay.
Okay, that was great, Dr. Okay, Dr. Larry, do you want to add something? Any one of you guys want to add something? Please let me know.
Well, you know me. For me and to me, everything about empathy and reassurance is the most important thing. So,
Yes, exactly.
so
That's
yeah.
why You always pass your Oscar, doctor, right? Why? Because you
Yeah.
always take the patient as the first concern, no
I
matter
even
what.
I even almost cried in my exam, and it was such a good actress, and I was teary. I was feeling it. I was just like, oh my gosh, I'm so sorry. I want to help you. Can I give
Yes,
you a
you
hug?
must.
No,
Yes,
I didn't
exactly.
say that. I didn't
Yeah,
say
why?
that, but
I'm saying you must feel the patient. You must.
yeah, I didn't say that obviously, but I was
Yeah, I know.
feeling, the whole
Yeah,
part.
but emotion, yes. So, how we call it? The social intelligence is something very, very
Mhm.
important. Emotional intelligence, social intelligence, very, very important things in this
And
life.
what you said, Dr. Peter, is just absolutely 100% right. Like I've had many, obviously, as everybody knows by now, like I've done exam 3 times. And if I can see something is like in constantly, something is constant, it's like I always keep my empathy, reassurance. I follow the whole part. Sometimes I feel that I don't have a flow like I should, because we're always trying to kind of like finish the case, but you don't have to. Like, if the patient is asking you something, you need to answer. You need to answer because it's just your job. You're there to listen to the patient, to answer to the questions as well. So, yeah, main thing, number one, ballpark. Number two, yeah, chief complaint, reassurance, and answer to all the patient concern.
Make the patient happy. That's it.
Yeah, absolutely.
Make the patient happy.
Absolutely. I always say I'll give you my house. Don't worry.
Yeah, I wanna pass. Yeah, yeah, that's good. I make you happy then. Okay, that's great. Then, Dr. Anna, do you have any question about this part? Dr. Andrella, please, guys, tell me.
Just
I think Dr. Amna did good. Oh, sorry for
no,
interruption.
please go ahead.
You just did good, but
Thank
in
you.
somewhere, as Dr. Bido mentioned, there was some negative approach, like friend friend recommended that cassia something drug that should be subsided from the mm, consulting time, and uh, other is okay. I think first one was she was nervous. I think,
Your
but
patient can be
next,
anything. Patient, you're right, doctor. Patient can be angry, can be upset, can be happy,
yeah,
can be insistent, can be persistent, can anything. As dentist, we must deal with every single situation.
yeah, with
You're totally
positive
right.
approach and with sympathy. Patient should think that the dentist is here to help me with my problem.
Totally agree this one. Very good one. Yes. You see, I love this thinking as well. That's very good.
Thank you.
Okay, Dr. Amna,
The
I
Emrons,
would
Dr. Biro,
yes.
the
Can you?
risk, you know, right here I see it's high risk. Okay. So, hello?
Yes, I'm listening. I'm listening to you. I'm
Yeah.
listening to you.
So, can I consult specialist here?
Ah, you can, but still you can do the treatment by yourself. No problem. Yeah, you can definitely consult. No problem at all.
Just second opinion.
Why not? But I think look, if you wanna still like to consult, fine. But I think you can do the treatment in your own, even so.
Okay.
Yeah, why not? Yeah, both fine. But I believe even you can still take it. Better to take in your own because there's not that much that risk can happen.
Yeah, and they're
Okay.
on oral medication. Okay.
Yep, I even oral medication not that much. Yeah, maybe only because corticosteroid together. That's why I made it. But apart from this, okay.
Yeah. Okay.
Okay, no problem. That was great job, Dr. Amna. You have the second time was way
I'm
much better.
not satisfied. Let's do it
I
again.
know you, Dr. Amna. I know you. That's okay. Not the
Let's do
first
it
time in the role play.
again.
The first time I meet you, and I know you very well. Okay, that's
Okay.
okay. In Academy, we can discuss all this point together. Fine.
Well, we have to give a good point to Dr. Amna, which is like she's performing like in front of I don't know how many people are on Facebook, how many people are on YouTube, all the people on
On Zoom,
Zoom.
yeah.
Like we
I
I feel
couldn't.
that.
I didn't even think of that. Now I'm nervous.
She's probably gonna be like famous, like maybe a YouTuber
Everyone
or
knows Dr.
something.
Amna. Everyone don't knows Dr. Amna very well, definitely. And I know him
So,
more than any one of you guys, by the way. She knows this, okay?
of course, but it's a big effort, and it's really nice that you took the step forward and did it twice.
Yes, she's very good. I know Dr.
Thanks,
Amna, she's very
Ray.
good. And she improved a lot from the first time as well, because I know the stuff, Dr. Amna. I know her very well. Okay, thank you, Dr. Ann. That was great, especially the second one. The only thing is, the first one, I was as a patient, I only needed just some reassurance. And I feel that you care about me more than you care about the case, and that's it. If you could have done this for the first one, it was amazing as well. Second one, you did this very much. Okay?
Okay.
I even felt in your voice, and I felt I'm happy that I did this with you first one, so to not repeat in exam, because second time I felt your voice somehow you really cared about me in your voice, which I really like it very much.
Okay.
Okay,
Thank you.
thank you very much, Dr. Anna. Thank you. Then thank you every one of you guys. I see you guys are doing great, and everyone, by the way, likes your role play, Dr. Anna. I see this. And when I look now on the Facebook, everyone say excellent, Dr.
Oh, thank
Amna.
you.
Look, everyone say those excellent job, Dr. Amna. And you really did very good job. I can see. You see, even patient's priority, yes. Big thanks to Dr. Look, Dr. Manpreet says, big thank you, Dr. Amna, for the case discussion, Dr. Vido. They like you very much. Good job.
Thank you.
You see, big heart to Dr. Anna. Respect. This Dr. Breya, everyone. Yoga, you see, try yoga, Dr. Natali. Yes. Who's gonna try yoga? The patient or Dr. Amna? Which one? Or me? Which one of us? Good job, Dr. Amna. Everyone say good job,
Try
Dr. Amna.
yoga.
Yes, you did
Okay.
very good.
Okay. I can't
Okay,
do
no.
yoga these days, but okay.
I know why as well. I know why you cannot do yoga now, Dr. Amna. I know why.
Okay.
But after sometimes you can do definitely.
Yes, I need
Okay.
it.
Yes, I know. No problem, Dr. Amna. Even I'm not in same like you, but I don't do yoga as well.
Hmm.
I don't have the same reason like
Same.
you, but I don't
Okay.
do.
I don't do yoga either.
It's good as well. I think the things actually can control
Is
this can
cortisol
control the
high?
stress.
That's
Yeah.
a good question. Is cortisol high during morning?
Yes, hi. That's why people they have diabetes. When they wake up with more cortisol in the morning. That's why we have something called how we call it on diabetes dawn, the dawn the dawn raise blood sugar or the morning raise blood sugar
Mm.
happens if you have a sensor in your body or maybe eh, like with researchers they found that's at the highest sugar level when you wake up straight away. Once you wake up the cortisol start to be high because cortisol will be high. Yes, Dr. Afra, you're right. Yes,
Okay.
but this is just only to wake you up in the morning. And this is can relax you, make you somehow relax at some level because when you have cortisone, your body can relax somehow because cortisone comes after you become upset or angry. So when you have cortisone, it slows down the things and then you become good again. And then your body became after cortisone become like very relaxed after this. So when you wake up, once you wake up, you put your eyes up, the cortisol is high. Then you start your day, cortisol goes down, you relax, everything become fine again. Okay, thank you very much for this. Okay, guys, have a great night, every one of you guys. Thank you, Dr. Anna, Dr. Larry, Dr. Andrella, and all the champions. See you tomorrow then, guys, everyone. Thank you
Thank
very
you,
much.
Dr. Peter.
Thank you,
Thank you,
Dr.
Dr.
Video. Good
Larry. Thank
night.
you,
Good
Dr.
night.
Amna. Thank you, guys, very much. Thank you. Bye, bye, bye.